Good afternoon, folks. I've got discussion A for you today. We're discussing how functional medicine is changing today's healthcare. So here we go with today's discussion. Give me a minute to set up for the show, and I'll be right with you, please. Okay. Title: How functional medicine is changing healthcare. Traditional healthcare models. U.S. healthcare has largely been reactive, treating symptoms with medications or short short term short term solutions after illness occurs. Functional medic Functional medicine approach focuses on restoring whole body balance by identifying and addressing root causes rather than isolated symptoms. Holistic philosophy emphasizes individualized care and long term wellness instead of quick fixes. Growing popularity. More people are seeking out this proactive approach, making a shift in how wellness is understood and delivered. This shift could have have a have major implications for the kinds of care models you work your you work with, especially those centered on patient autonomy, preventative frameworks, and in interdisciplinary integration. Want to dig into how how this meshes with frailty aware or memory friendly models next. Absolutely. Functional medicine represents a notable paradigm shift, and it aligns strongly with many of your priorities around preventative frameworks and autonomy in care. Functional medicine in depth. Root cause focus. Instead of treating symptoms in isolation, functional medicine seeks to uncover the underlying uh, physical or physiological, environmental, and genetic causes. This often means exploring how interconnected systems contribute to disease expression. Personalized care plans. Pioneers, practitioners gather detailed histories and biomarkers data to craft interventions tailored to each individual, something that echoes your work in memory friendly and frailty aware design. Systems biology lens. The approach draws heavily from systems based neuroscience and other interactive sciences, making it particularly relevant in aging and neurodegeneration contexts. Lifestyle and nutritional emphasis, diet, sleep, stress, relationships, and movement aren't just secondary, they're functional, anti inflammatory, and neuroprotective diets. When you're already curious about the staples in this space, therapeutic partnerships, patients are active participants. This model embraces shared decision making and long term engagement, fitting for your focus on dignity and autonomy in elder care. It's less about what drug fixes this symptom and more about what dysfunction is leading to this symptom and how can we restore balance holistically. Would you like to explore how this model could integrate into smart housing? Environments or caregiving education frameworks next. Functional medicine offers a refreshing and often transformative lens for treating chronic conditions, especially when compared to the conventional approach that often emphasizes symptom suppression. Core strategies for chronic conditions. Systems based mapping. Chronic conditions like autoimmune disorders, diabetes, or neurodegenerative diseases are viewed as interconnected disruptions in body systems, not isolated malfunctions. Root causes investigation. Practitioners delve into genetic predispositions, environmental exposures, and microbiome health and lifestyle habits to identify what's fueling chronic inflammation, hormonal imbalance, or metabolic dysfunction. Lifestyle centered protocols. Instead of defaulting to long term pharmacological intervention, functional medicine integrates nutritional therapies, elimination diets, and anti inflammatory regimens, sleep optimization, stress reduction techniques, movement protocols tailored to the individual's resilience level, personalized biomarker tracking, ongoing assessments of inflammatory markers, hormone levels, nutrient deficiencies, and other functional indicators help guide adaptive treatments plans. Patient empowerment. The goal is to equip individuals with tools and understanding to become active participants in revising or managing their conditions, not just coping with it. This approach particularly resonates in frailty aware and memory friendly frameworks, where long term engagements and system wide balance are essential for someone like you who's deeply invested in equity, autonomy, and interdisciplinary design. It opens doors for highly personalized elder care strategies rooted in resilience and recovery. Would you like to explore how this ties into collagen health and aging resilience over or dive into specific chronic examples like dementia or post concussion syndrome? Functional medicine brings systems thinking approach to elder care, an approach that echoes much of what you already champion. Autonomy, resilience, and tailored support rooted in dignity. Functional medicine in elder care. Frailty aware frameworks. Aging isn't treated as an inevitable decline. Instead, practitioners assess underlying drivers of frailty like chronic inflammation, nutrient deficiencies, or hormonal shifts, and personalize interventions to restore function. Okay, cognitive health integration. There's emphasis on root causes, work for conditions like dementia or and post concussion syndrome. This might involve gut brain axis analysis, toxin exposure reviews, and regenerative therapies to support neuroplasticity. Lifestyle as medicine. Elders are supported with anti-inflammatory diets, sleep optimization, and movement protocols adapted to mobility constraints, all grounded in biomarker feedback and continuous evaluation. Therapeutic relationships. Care is not delivered to elders, it's co created with them. Shared decision making honors their preferences, cultures, and needs. And emotional landscapes aligning beautifully with memory friendly and culturally responsive caregiving. Tech-enabled personalization. Functional medicine dovetails with smart housing systems and predictive behavioral tools, enabling proactive care that adapts to individual markers and evolving frailty levels. This model flips traditional elder care from managing decline to fostering recovery and empowerment. It's especially potent when paired with your interest in caregiving or caregiver education and interactive training, offering a framework where every touch point is rich with opportunity for restoration. Would you like to explore how these principles could shape a smart housing prototype or caregiver training module tailored to functional principles? Absolutely. There are compelling examples where functional medicine principles have transformed elder care from passive support into proactive healing and personalized empowerment. Let's walk through a few real world applications of functional medicine and elder care. Cognitive decline and dementia. Pioneer practitioners have used gut brain axis analysis and toxinous exposure testing to uncover inflammation or nutrient defects contributing to cognitive decline. Interventions might include high dose omega 3s, B vitamin regimens for homocysteine regulation, and therapeutic fasting protocols to simulate autophagy and neuroprotection. Post-concussion syndrome in aging adults. Functional assessments are often highlighted. Underlying vestibular or hormonal dysregulation. Recovery strategies include personalized vestibular rehab adaptations, adaptogens for stress modulation and targeted collagen support to bolster tissue integrity and neurovascular repair. Frailty reversal in long-term care facilities using biomarker screening, CRP, hormone panels, nutrient profiles. Clinicians create resilient focus plans, anti-inflammatory meal planning, sleep hygiene interventions, and low-impact physical therapy tailored to mitochondrial function. These models have shown improvement in gait and speed, cognitive alertness over time. Memory-friendly smart housing, integrated functional medicine programs. Within smart housing prototypes, monitor behavior shifts, sleep patterns, and nutritional logs in real time. Adjustments are then made dynamically, like shifting magnesium supplementation or tweaking lighting to enhance melatonin production, therapeutic relationships, and culturally responsive caregiving. Functional, functional practitioners work with families and caregivers to align interventions with and even spiritual preferences. This elevates shared decision making to a relational art form, especially impactful in late stage neurodegeneration. These examples showcase a care model that deeply align with your drive for, uh, drive for systems thinking, equity, and restoration, not just management. Would you like to prototype one of these concepts within a smart elder care framework or create a caregiver training module grounded in functional principles? Okay, guys, so that is A for you. I'll be back on shortly with B. Give me a little bit for B, please, and I'll be back on with that for you in a few minutes. For now, Gator Wellness, take care, folks.